Hello, hello. Can you hear me? Hi, Heatherly. How are you? So, can you all see the chat? So, as the subscribers or individuals who are watching come on, they will chat with you. So, we'll talk with the chat, we'll answer their questions, and then they'll have comments as well. So, I don't know if you can see that Heatherly said hello to each of you. So, make sure you hit the like button and thank you for being here. And we're talking about menopause once again this week. This is our third episode in talking about this topic. And tonight we have two. Hey, Kendi K. All day. So Kendi K said, hey. So, again, we're talking about menopause. This is the third episode, and we have two doctors as well as a professional counselor who is going to share her story with going through menopause and what she does to combat some of the issues. Well, I don't know if I could call them issues, some of the side effects. Some of the symptoms. There you go. Some of the symptoms of menopause. So we'll start with Dr. Johnson, then we'll let Dr. Fowler go, and then we'll let Java speak.
Hello, everyone. I am Selena Johnson. I am a family medicine provider, and I am postmenopausal with still symptoms.
Okay, and then please tell us more about what symptoms you're having post menopause.
Postmenopausal.
Yeah,
Okay,
so you don't have to do that yet. Hold on, wait for the comment. Yeah,
sure will.
Yeah, go ahead, Brian, or Dr. Fowler.
Hey, my name is Brian. I am a cardiology fellow at The Ohio State University College of Medicine, or Wexner Medical Center, I should say. Glad to be here and talking about menopause a little bit.
Yes. And then next we have Miss Java Holiday.
It's actually Roberson now.
I knew that. I'm sorry, Dave.
It's all good. I'm Java Roberson, and I am perimenopausal with a lot of the symptoms. So let's get into it.
All right. So then let me start off by saying, so when you're in perimenopause, you have all of the symptoms of menopause. So this is a laid back conversation, and I got all kinds of questions.
So first, I think a definition of what menopause is.
Okay.
So menopause is basically when your menstrual cycle has stopped for completely one full year, so 12 months. And after that, then you're postmenopausal. Okay. Perimenopause is that time in between where your hormones are going down, your eggs are getting fewer, your periods are irregular. You get long ones, you get short ones, you get none as time goes on. So that's in that age range, about 40s to early 50s for some people. So if some people want to call it premenopause, but menopause basically is menstrual cycle paused, if you look at it like that. And so if you've not had a period for a complete year,
Okay,
but you are now in menopause.
But it's peri if you missed a month or two.
You're still perimenopausal.
Okay. So then, Java, going back to you, you said you had all the symptoms of menopause. So the only difference is having your period maybe periodically versus not having it at all, but the symptoms are the same.
Well, I mean, from my understanding, yes. So the hot flashes, night sweats, weight irregularities, mood changes, brain fog, joints aching, thinking it's arthritis when really it's my hormones, which, now that I'm doing the HRT, I definitely see the difference. My hips don't hurt like they used to at all. So yeah, and then I was going stretches of, I was like, yes, I'm about to be in menopause, because it would go like, and then 6 months, then I have a period. I was like, dang, okay. Then I go another stretch of 6 months with no period, then have a period. Like, dang, like, oh, okay. They tell me it's got to be a whole full year before I can say I'm in menopause, but it was coming once every 6 months.
So when, because we had Gwen on and then Brandy, they both take HRT or, use HRT. Oh, what was I going to say? I forgot my question.
See, that's that menopause, perimenopausal brain right there.
So let me tell you. No, let me tell you. I'm sure that I'm in menopause or perimenopause, right? So I had a hysterectomy in 2007. So my cycle was cut off a long time ago, right? But I don't experience a lot of the symptoms, right, to make me feel like I'm in menopause or perimenopause.
So you are surgically menopaused.
But I still have my ovaries. I only had a partial.
So that's the other definition. So a hysterectomy is technically the removal of your uterus.
Okay.
So if you've had a hysterectomy, you've had the removal of your uterus. People say partial hysterectomy because they say I still have my ovaries. When they remove your ovaries, it's called an oophorectomy. So you had your uterus removed. Mm-hmm. Your uterus is what is needed for you to have periods, but your ovaries are the ones that are the eggs that are giving you the estrogen that you need. So when they removed your uterus and they left your ovaries, it's now the matter of the estrogen or your ovaries or your eggs going bye-bye. Because remember, we come here with all the eggs we're ever going to have in life. And as they go down, as you lose your eggs, when you have a menstrual cycle, that's you flushing out your eggs. Once you don't have a uterus anymore, there's nowhere to flush them. So you don't have the uterine lining and all of that good stuff that's there to protect the baby, but you're not having one, but you still have those eggs. As your eggs start to go down in number, your estrogen levels start to go down in number, and that's where you get the hot flashes. That's where you get the brain fog. That's where you get the mood swings. But the problem is with a lot of us, including me, I had my son just before I turned 39. So now I'm perimenopausal probably, but I just had a baby. So I got other hormones going on. So everything I had was just kind of discombobulated and I had no clue. I was just waiting for my period to stop because I had no clue what was going on. But that's the difference. So you had surgical menopause. And so you'll still have those same symptoms because now your eggs are decreasing. Your eggs are decreasing, your estrogen is decreasing, and you're getting those other symptoms.
So then did my menopause, did I start going through menopause in 2007 and I just did not recognize the signs and symptoms?
So because you no longer had a period, you were in menopause. You just didn't have the other symptoms because remember, we said the definition is no period. Right? The reason why we're not having periods or our periods are irregular is because of, for the whole purpose of the eggs. When you have the eggs, they're going to go to the uterus because they want to be implanted, they want to be fertilized, and they want to have a baby. If that egg is not fertilized, your uterus is all prepped to hold a baby, and that's why you get all the, I'll just say, nutrients. But if that egg is not fertilized, then that egg is going to go away, or it's going to be flushed out. And with that comes all the uterine lining, and that's where you have your menstrual period. And that's the whole purpose. It's your uterus is ready to hold a baby, but if you don't make one for whatever reason, whether you don't want to, it just didn't happen, if you don't make one, then your body says, well, we don't need all this stuff here in this uterus. Let's just flush it on out and wait till the next egg comes. And that's where you get those menstrual cycles, when those eggs are dropping into your uterus. So for you, you no longer had a uterus, which means you no longer had anything for the eggs to go to, but you still had those eggs. Those eggs are still producing estrogen. When you start to get fewer and fewer eggs, you get less and less estrogen. And so now you're having the hot flashes, you're having the mood swings, you're having vaginal dryness, you're having um, sweats all night. And then all the other things that people said that they could have. And some people are fortunate enough not to have any of it. But I also tell people that when you're having those symptoms, you need to go to your doctor to make sure that you're not having other things, because as we get older, other things change. Our thyroid functions can change, which can give us the same kind of symptoms.
Gotcha. Hey, SBK. Hey, Jasmine. So we're talking to Dr. Johnson, Dr. Fowler, and to Java, who um, is going through menopause um, and using HRT to help her navigate the symptoms. Dr. Fowler, what you want to add to the conversation? Because
No, I think that is important to understand the whole process of um, like the path of the ovary, and why women have periods, and ultimately why they end up having those menopausal symptoms. I think that was a great explanation, and it was certainly spot on. I think that is important to understand.
mm-hmm. So why do so when Gwen was on, because remember I told you this is the third time we talked about this conversation. This is episode 3. Gwen talked about menopause being different for African American women, the symptoms showing up differently for African American women or women of color and Caucasian women. Can you tell me like what some of those differences are and why the differences?
I don't think I was in on that part of the conversation with the differences in symptoms from the people that I know. And I'm not saying that it's not true, it probably is. But people that I know, African American, people of color, and not, tend to have some of the pretty much the same symptoms. I think another part is usually in our culture, we connect a lot of different things to a lot of different things. And then we also may have other medical conditions or other mental health conditions. And so it all gets jumbled up. Um, Even with me, I literally thought, I was like, okay, for some reason, I'm just depressed. I don't know why. So I went through, I'm like, okay, look, you need to give me some antidepressants. You need to do this, this, and this. And it's not working. So I was like, okay, well, maybe we need to just go back and try the hormone thing. Um, but I think it's a combination that we get a lot of things just as we pass them down or not pass them down. And for certain people's cases, it's not passed on and we don't know. So, you see Aunt May over there fanning, oh girl, she's having hot flash, she's going through the change. But she could be fanning because she got something else going on, but we just assumed all of it's there. So I'm not really sure what the differences are. And it's also, I think, because research is a lot of times done not with us. So if you're not using us as for research, then you're not going to get what symptoms we have as much. So, just like, we present differently with heart attacks and things like that. And that's because they're not testing us or they're not asking us or we're not in as many of those studies to get those kind of answers.
Gotcha. So let me address Miss Alice real quick and Kyra. Thank you for joining us, joining in on this conversation. Make sure you hit the like button. Brandy is not here tonight. She's usually here. She's not feeling well, so I gave her the day off. No, she's not. She's not feeling well, so she's not here. So, but again, thank you for joining us. Heatherly asked, should I stop using pre-workout powders? As in creatine good for you during menopause? And is creatine good for you? So let me say this real quick. Right? Yes, we have two doctors on the panel, right? A cardiologist and a family medical practitioner, family medical doctor. This information is for educational purposes only, right? So the information that we share or that they share, please, please, please check with your own physician. Okay. So I said my little spiel. So should she stop taking pre-workout powders? And is creatine is good for menopause?
I can answer this one. I certainly agree with your comment, Wanda. Questions that everyone like may ask us, we can certainly give like a somewhat like generic answer based on like medical literature and things like that. But the best answer for you would be from your own your own doctor, because they are well aware of your medical history, what medications you take, things like that, which can impact this advice and supplements or medications and whatnot that may be given. So obviously we don't have that information, so we can only give broad strokes of information. But to answer your question on using workout powders, there's no literature, at least that I'm aware of, that there's any concern of you using any like pre-workout. And creatine, which is one of it's actually a really good supplement. I actually use it myself for working out. It may actually help with symptoms of menopause, and I say that because one of the benefits of creatine is it does help with mood and cognition, and that is one of the side effects or symptoms, I should say, of menopause. So it may actually help. Certainly won't hurt you in any way.
All right, Heather Lee, sorry. You do not have to stop your workout powders, but you talk to your doctor. But doesn't sound
please keep working out, though.
Yes, please keep moving. Please keep moving. You definitely got to move more, sit less. Okay, so there's HRT. So Java, explain your experience with HRT.
So I use BioTE, BIOTE. It's a brand of hormone replacement therapy. And my experience with it is we initially had to go do blood work so that they could check to see where all my hormone levels were, where my estrogen was, where my testosterone was. I think it's FSH and T something else. I can't remember. But when they looked at my test results, they could definitely see my testosterone was like bottomed out. Like I had 0.69% of testosterone. And it's supposed to be, I think, between like, I forgot the numbers. I had the numbers, but I had to switch to my phone, so I can't even pull it up to tell you. But whatever it was, mine was at very low. So with that information, and we tested my vitamin D as well, because we know that vitamin D also can cause, lack of vitamin D can cause depression-like symptoms as well. So they checked the vitamin D, checked my hormone levels. They made me do maybe have a mammogram, do the, what is it? The 3D, not just having my breast smashed between the machine, but then also doing like the ultrasound mammogram, and then the pelvic ultrasound to make sure that there weren't any fibroids or anything else going on in the uterus. Because again, when you're talking about hormones, it can increase your cancer. There's a correlation, they've been saying, between adding these hormones and cancer. So they wanted to check and screen and make sure none of that was happening first. Once all that came back clear, then they have this program. This is why we use the BioT, because it's supposed to be more bioidentical. They put in all my numbers, and then the system spit back, okay, this is how many of the testosterone we're going to give her. They did not give me any estrogen because I do have my uterus and I do have periods. So they wanted to try to balance it and get my body to produce more of the estrogen to see if it can do it on its own and not give it to me, so that whatever, I can't remember the way she explained it, but which is fine. And then 6 weeks, which was just a couple weeks ago for me, because this is all new. I'm new to the HRT family. They retested to make sure that what they had given me was in fact doing what it needed to do. What I've gotten is pellets. So the pellets are put in through a little slit in my buttocks with this machine that they numb it, then take the pellet and put it in there. You can feel it. It's like a little lump, kind of like, what's the birth control that people used to get in their arm? That was like a little pellet. It feels like that. So that's, and then I got supplements. So they have what they call DIMS, which is natural hormonal supplements that include things like, I had all this on my phone and now I can't even pull it up because I'm on my phone on this thing. So what does it have in it? Let's see. Pomegranate. Look, I can't even read this. I don't have the right glasses on either. But anyway, this is the BioT DIMS that they give you to help with, again, increasing all those hormonal things, lowering, I want to say it's FSH because mine were really high, and it's a TSH maybe that they tested too. I can't, I'm sorry. I don't have the information in front of me, but those are the things. So what I've noticed in the 6 weeks, my hot flashes have decreased tremendously. Like, and if I have one, it doesn't last as long and it's not as intense. At night, I definitely don't wake up thinking like, oh, I got to get up, change my clothes, change my sheets, change. I'm not doing any of that anymore. Joint aches have diminished. Like my hips used to hurt, ankles hurting, like all that has gone away. I don't experience any of that. Definitely an increase, I'm sure, for my husband in libido. I'm a newlywed. And so like when that libido started going away, I was like, oh Lord, what just happened? Like what happened? Like I've only been married for a year and yeah, I could care less. I could care less. But since in 6 weeks, like, yeah, we newlyweds.
Okay. Okay.
So that's definitely a plus. Trying to think what else I've noticed in the last 6 weeks since I got it done. And I'm saying we because there was a group of ladies here that we all went together. And the ages, I was the youngest of all of them. I'm 53. I'm the youngest of them. The oldest person is 66, 67, I think she is.
Oh, and she still need a hormone replacement?
Mm-hmm.
Wow. Okay.
They're saying like you can get it up into your 80s. The doctor that we talk with, she says she has a client that's 80 years old. And again, you know, you hear all this stuff about, oh, you can't do hormone replacement, you'll get cancer, you'll this, you're that. But currently, all I can say is I feel like it's been a godsend. My body don't hurt. I feel clearer. I feel like the light switch came on. It's not as dim as it was before. Like I said, the sweating, like, oh my God, like that in itself, just, yeah.
Okay.
And the increase in libido for sure.
Gotcha. So what questions, and then all three of you can answer this. So Java, what questions, did you have for your doctor? And then Selena and Brian, what questions should women ask, right? What tests or exams should they ask for?
So a lot of the, like, yep, I asked about the cancer, and whether, how was this, how did they test it and all the things. They gave us a nice pamphlet, gave us videos to go and watch. One of the ladies, she's been doing it for 10 years. She turned 62 a couple of weeks ago. She's been doing it for 10 years, and she talked about like what it was like, life was like for her before the pellets as compared to what it is now with the pellets. And she's like, at the end of she gave 2 months. She said, I'm gonna need my tip from all y'all husbands because they're all gonna be pleased with the results because of the increase in the libido. So all the ladies, I think I was the last one actually to get on the libido kick. Like one of the ladies, hers kicked in 2 weeks. The other lady, like when she was saying like maybe she needs to get hers decreased because she going after her husband 3-4 times a day. So, and she was like me because she still has her uterus, was only given testosterone and another supplement. It's an oral supplement, and I just ran out, or I can't find my box, so my husband got to go get some more. But it's I'm sorry, it's in my phone, and I can't go get it because I'm on it. I'm sorry.
Right. Okay.
But it's not estrogen. It's the other. What's the other one that they give you instead of estrogen?
Progesterone.
I hear you, Selena.
Yeah, I think it's a progesterone peel. Yeah, instead of the patch, they gave me a peel.
Okay. So Selena, Brian, like what should like women and their significant other, right? What questions should they ask? What tests should they be asking for if they think they may be going through, if they think they may be in perimenopause
I
or
want to
new
start out
menstrual
with, I
cycle?
think women, we in general need to um, be aware of our bodies before then, and me included. I think we miss out, and then when things start to change, that's when we want to try to figure out what's going on, and that's fine because that's kind of how we trying to pick up from what we know. So one, just taking care of yourself in the first place. When you go to your doctor, obviously, if you haven't had a period in a while or your periods are going to get irregular, the first thing they're going to do is ask you if you're pregnant. Okay. Or could you be pregnant? And even if you say no, most of us are still going to make sure that you're not before we do anything else. But there are certain things that can also cause you to not have a period or for your periods to be irregular. So when we're talking about tests that are being done, it's kind of based on your symptoms. Now, some people will get FSH and LH and those different kind of things for hormone levels. But because your numbers go up and down, depending on what time of your whole menstrual cycle you're in, your menstrual cycle is not just having a period, it's a cycle of hormones going up and down and leveling out for different reasons. And so to go in and say, okay, well, today my number is this, well, next week it could be something else. So it's not really, when you talk about the symptoms, um, include, we're going to ask things like, we're going to check your blood sugars because what if you have diabetes or what if you have something else? Are you taking medicines? Have you changed other things in your life? But be persistent. And I say this a lot because as a general practitioner, family practitioner, you go to your family practitioner for something, and a lot of times you come in, and I understand nobody wants to do the copays and you don't understand, but you can't come in with 12 problems and think that all 12 are going to be solved that day. So I usually tell people if it's something that is really, really pressing to you, make your appointment. And when they say, what are you coming in for? What is your appointment for? I think I'm in menopause, or I want to know. And so that prepares your provider for knowing what you're coming in with. Because if you come in and say, oh, I'm feeling depressed, then we may go down that depression road, or I'm feeling sluggish, or I'm gaining weight, then maybe we'll check your thyroid. So it's a kind of, a back and forth, understanding, trusting your provider, and then knowing your own body. Because if you can't tell us, we can't help you in certain areas.
Hmm. Okay.
Hormone replacement, everybody is different. And so that's why, Java's treatment sounds different from what Gwen had. And that is, again, a conversation that you have specifically with your provider. And if your provider is not comfortable with that, find someone else.
Hmm.
It's always your right, and your right to yourself to take care of yourself. And if they can't do it, ask for a referral, ask for a second opinion.
Mhm. So how how does natural remedies work in comparison to the HRT? Because a lot of people are scared um, with some of the information that's out there about HRT, right? Um, and they may opt for a natural remedy. They may not want, I think, what did you say, Java, a slit in their butt? They may not want to get a slit in their butt and a pill or a.
It's so tiny though. It's just a little teeny tiny thing.
So there are pills, there are creams, there are injections, they got and things. And so there's different options. There's patches. So it's everyone is going to be different. It's going to be what's good. If I remember, I think I heard someone say that she didn't do well with the patches because they kept falling off. Okay, so then let's try a pill. For some people, if your symptom is only vaginal dryness, then you go and get a topical, something that goes vaginally. Because if that's your only concern, that's your only symptom, you don't have to do everything. So that's why it's a matter of you talking to your provider and finding out what your symptoms are and what's going to work for you. And it is a learning process. It's not, I hope it works right away, but for some people it's up and down. If you're closer to just becoming menopausal, or if you're perimenopausal and they put you on hormones, it can change your periods again if you have them, or you can start spotting. And some people don't want to do that, you know.
Yeah, that's the one thing that I'm most concerned with, because I was kind of like it not having a cycle but every 6 months. And so I've already had a cycle since I started the HRT, and I'm just like, oh Lord, I got to do this every month again. Like, I don't know. Maybe I want to go back, but then I was like, oh no, I don't want the night sweats. So it's like one of those catch 22s. Do I do the night sweats or no period kind of thing?
Real quick. Hi, Lala. Welcome in. We're talking about menopause and all the wonderful things that come along with it. You may be too young, and I don't know how old you are, Lala. And of course, you don't have to tell me. And it could be all that juicing and eating raw that you do while you look so good. Um, but this topic, may not be something that you're experiencing right now, but keep on living. You're going to go through it too.
And that's the plus of menopause. I was trying to think of something positive. That means you're still alive.
Yeah.
You're still alive, and I'm with Java. Not having a period, you can swim anytime you want to. You can
Right.
do whatever you want to.
Right.
So there's some pluses to that.
Yeah. Thank you for sharing. And yes, hit that like button, share. And she said she ain't got no menopause. She said she's too young for that. Hi, Elevate. Me two times Elevate. Thank you for joining us. We're talking about menopause. Thank you, thank you, thank you. Brian, Dr. Fowler, did you want to weigh in? Yeah, Lala said she's 45, but very healthy. She's
I'm not getting close.
Say that again, Brian.
I said, Lala getting close.
Yes. Hi, Senna. How are you? So, real quick, let me do a quick recap. We have Dr. Selena, Dr. Johnson, and Dr. Fowler. And then we also have Java, who is currently navigating the symptoms of menopause and perimenopause. And she has chosen to do HRT, and she just shared her experience. So if you have any questions, ask away. But it's not to take the advice or not to take the place of your doctor, your primary physician. All right. Let's see. What other question can I ask? So I think you answered this, Jay. What led you to consider HRT versus a natural path?
Well, when I looked at all the things that people was telling me to go and get, Naturally, I would have been taking like 13 pills a day. And I definitely didn't want to do that. Yeah. And so I did some research on what led them to the correlation of HRT and cancer, and looked at that study and looked at a couple of other studies, and then looked at all the praises of HRT versus the negative things that I've heard. And then it also helped having a friend that had already been doing the BioT HRT for over 10 years, and her talking about what life was like for her prior to, and then what it is for her currently, and her knowing like, oh, it's time for me to go get another pellet, because they're saying like the pellets can last. And again, I'm in the trial phase to find out like how long my pellet is going to last, and how my body will metabolize it. So again, in 6 weeks, my doctor and I will test again to see where my levels are with, but she gets hers every 5 to 6 months. So I'm hoping that, twice a year I'm able to go to get the pellets.
Oh, okay. So real quick, Lala,
Mm-hmm.
and me 2 times elevate. We're talking about. I'm laughing because Lala said, "I don't know what they talking about. I'm just gonna keep hitting the button." We are talking about menopause, right? We are. I'm hoping to educate. We're hoping to educate women if you are currently at the age of going through menopause, um, or if you're a woman, because if you're not going through right now, baby, I guarantee you, keep on living, you're gonna go through menopause, right? And you should know what to expect, especially if, and Jasmine, I'm going to get to your question. If with your significant other, you want your significant other to know, when you don't want to be touched, when you're pushing him away, that could be menopause, right? We talked about vaginal dryness. Lala said, bring it on. Yep, talk about vaginal dryness. When you have mood swings, and you want to knock his head off, and you're snapping at him, right? You want him to be able to handle that and understand that you're not just being mean. So that's what we're talking about. We're talking about menopause and all the wonderful things that come along with it. She says she don't want to get dry. They say it comes with it. It can come with it. She said, pass the lubricant, Alex.
So with that, we're talking about vaginal dryness and things like that. I would say knowing is important. And then your partner also knowing that, this don't feel good. It's dry. With you knowing that, everybody does not get, we've already said that everybody does not get all of the symptoms. Because again, your estrogen levels are going down. That means that's going to cause some vaginal dryness, or it can. So lubricants are good. But if you have an estrogen lubricant, now you're just putting back what you're missing. So when we're talking about, and people say the natural versus, hormone replacement, and even over the counter or natural, there's still things that aren't normally in your body. So I'm kind of one that will say, well, if I know I'm missing estrogen, wouldn't it be better for me to get more estrogen than to get something that's not estrogen, but it's going to make it feel better. And it could be for some people that you can use that. But if you like Java, if you're taking 15 pills to get the same effect as one pill, and then you're not worried about all the other side effects that you're taking, and then it's mixing with your other medications, and then you want to know if does this also is this why I'm bleeding more? Because some medicines will cause you to bleed more. And you got all these other things going on. So even when people say natural, to me, natural still doesn't mean that it's okay and safe for everybody. So you can overdo it with quote unquote natural.
I completely agree with that. So a lot of people feel natural being something that's not prescribed by a doctor. Um, but the one thing to think about is nearly every single medication that's prescribed by a doctor has gone through rigorous trials and for side effects and all these types of things, and we are well aware of them, which we always pass on to our patients, in discussions on if we're going to proceed with those medications or not. These quote unquote like natural medications typically do not go through such rigorous clinical trials, um, and a lot of times we aren't very confident on how exactly it's going to affect the body and the side effect profiles of a lot of those. So I think it is really important to think about that, because quote unquote natural isn't always the safest way to go.
The young lady that said, "Oh, I'm 49 and not having to worry about it." At 49, I wasn't worried about it either. But within the last year, it's like, okay, like I said, it started with not having a period, and I was like, "Oh, okay, it's been a couple months. Oh, it's been 3 months. Okay, wait, it's been 5 months. Oh, dang. Oh, here's a period on the 6th month." Then all the other symptoms gradually kind of kicked in, the hot flashes, the weight irregularity, even more so than it was before. Um, and when I say again at night, just to have my husband next to me, like you can't even get close to me because I can feel your body heat, which then makes my body heat go up, which then now I got to get up, change clothes, put a towel down for not the great reason we put the towel down, but because I done sweated through everything and I need to go to sleep. I'm trying to sleep. Um, Waking up in the middle of the night, when I say just pouring sweat, like I was asleep. I was minding my own business. Now all of a sudden I got to get up, change my clothes, find a towel, do all the things. So your sleep is interrupted. Then that affects your mood because I'm that 8 hour sleep. I'm gonna get 7 to 8 every night. So that was affecting mood and all the things was happening within a short period of time. It was like it just came on all of a sudden, like a light switch went on in my body, and it was like, "Hey, girl, I'm here."
Right? So please, 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 even if you're not, um, going through menopause, not thinking about menopause, if you are a woman, and I said it, if you keep living, you will go through menopause. You will go through perimenopause, right? Lala asks, how long does this last? A few months? It does not, Lala. So I'm gonna let one of the doctors weigh in, and then Java, I want you to weigh in because you're going through it currently. So just a quick recap again for those of you who just came in. We have Dr. Selena Johnson and Dr. Fowler, Brian Fowler. So they're going to give us medical information as it pertains to menopause and perimenopause. And then Java is going to, she's sharing with us her experience with it. So, how long does this last? A month? A few months?
So, just to recap, menopause is when you do not have a period for an entire year. So, just like Java said, she didn't have a period for 6 months, and then she had one, so she is still perimenopausal. Um, there's no number when it comes to menopause. Is once you are done having a period, you have not had a period for an entire year, then you are now considered postmenopausal. So your menstrual cycle has now paused and you are beyond that. Symptom wise, I can't tell you. I hear people say that they have symptoms 60 and up. Some people swear that they had no symptoms. And I think sometimes because we are, if we're very busy and we do a lot of different things, you may not recognize the symptoms or put it off as something else. You know, if you're working a lot and now you're always tired, well, I'm old and I can't keep working like this, and that's why I'm tired. And because I'm tired, that's why I'm grumpy. And because I'm grumpy, then this is why that. And you can easily explain away things. And then one day you don't have a period and you're like, oh, maybe that was menopause all that time or perimenopause. So there's no few months, hopefully 2 months, few months. I would love that. I have never heard that. So, but, and it's not happened to me that way. But more power to you. If it lasts a few months, God bless you. And I hope that happens to a lot of people. But I can't give you a real good number for that.
Um, oh, I want to put her comment up here. She said, "Oh, she said so when that the pause in menopause."
Yes, your menstrual cycle now has paused. Menopause. And not man pause. I heard somebody say that. Men on pause because you just don't want to deal with them either. But no, that's what it is.
She said, "I just learned that today." Well, all right, Lala. I'm glad we were able to spread some knowledge. But all of this, the last 3 weeks, or the last 2 weeks, and then including tonight, I've learned a lot. I really have. So let me get to Jasmine's question. So let me go here. She said, "Do you still go through menopause if you've had a hysterectomy?" So she missed that part of the conversation. If somebody would like to answer that. So I'll say yes.
Thank you. I was like, why do you tell her?
Yep. Because I had a hysterectomy in 2007. So yes, you still go through menopause. Yes, yes, yes. So Jasmine said, and this is one of the questions I started. Let me find it. Um, what questions do men need to ask the doctors if their significant other of when their significant other is going through menopause, right? Because he or she may not know. She don't want to be touched because she's not in the mood, right? Um, she may not understand the vaginal dryness, and I'm sure if it's dry down there and they're having intercourse, that don't feel too good, right? Um, so what questions should he be asking? And let me should he go to the doctors with her for the support? And what questions should he ask? And how should women be open and transparent about what they're feeling with their significant other?
Hey, Jasmine. I hope you are doing well. I haven't seen you in a while. Hope all is well. Um, I think the biggest thing for men is, it was kind of touched on a little bit earlier, but um, I think education is really probably the biggest thing. Um, because if the male is aware of some of the symptoms that come along with menopause, then again he um, or they may not, take it as personally because there's, a reason for it. So I think that's really probably the biggest thing is like educating yourself and knowing what to expect. As far as if the male or if the significant other should go to the appointment, um, I think that really depends on the woman. If she feels comfortable with him or anyone else going to that appointment with them. Um, Typically, uh, interactions with your doctor really is a very personal, connection and a personal time to, be able to ask any questions that you have and really go through a lot of things. Sometimes people may not feel comfortable talking about certain things with other people in the room. So I think that really depends on the woman and just how she feels about that.
So then,
And I
with
think it also depends on the man.
That's fair.
Because you do have some people who grew up with, I don't want to know about none of that. I don't want to hear about none of that. So you have to know your partner. So I think that's something that if you're already comfortable with doing that, if that's something that you and your partner agree with, because it's your health as well as theirs. Um, Men have changes too. And so I think as we get older, we have to understand that. And um, they can have we don't call it menopause. I don't know what we call it really. But so that's a kind of learning for the both of you and to understand and then to know, it's not personal. And I really don't like acting like this. It is currently out of my control. That's so and you have to look at it. It's not I won't say it's a disease, but it is a medical condition. And just like you take care of other medical conditions, it takes a while and you have symptoms. If it wasn't a problem, then people wouldn't go to the doctor about it, right? So we have to look at it as it's not its own little entity and this is this little weird thing. It's still your body. It's your body changing and doing what it's supposed to do. Um, it's, I don't want to be Sarah. I don't want no kids at 190 years old. They're gone. They're on their way out the door. We don't need no surprises like that. So there's a good reason why there's menopause. Um, we don't need to populate like that. But just to look at it, what's comfortable with you and your partner. So everybody's going to be different with that.
I would like to think, and maybe because I'm the type who would want to include my husband in on the conversation, that um that the man and the woman would want to go in together, right? Like, why would he want to have his wife or his significant other navigate menopause alone? Wouldn't he want to know? I would think, right? And I know this may not be the case in every relationship. So I do know that. But you would think he would want to know what's going on with my wife, what's going on with, my person.
I don't think it's what's going on. I don't want to know. I just think because I work with different cultures and certain things, it's going to be this is a woman thing and this is how we are. And it's not that he or she, either way, feels that um, they don't care. But you also have to look at their culture or their upbringing. And then again, that's a conversation between the two of you because everyone's going to be different. Or some women may not feel comfortable with their spouses in there because You also have to understand your spouse. So if you tell your doctor, hey, I don't really like having sex right now. Now, what you're saying is, I'm dry and it doesn't feel good. But what your husband may hear is, she don't want to be with me.
Ah, okay.
So you got to
Okay.
look at it from both ends. And again, you know your spouse, and your spouse knows you, and you guys work that out.
Right.
Like I said, I think I was very thankful that I had a group of women. And again, I'm the younger one of the group. So to be with other folks, women who are experiencing it that are married as well, and me saying, oh my God, these hot flashes. And then she chimes in and says, yeah, girl, you're going to be going through it. That's what I'm having. Da, 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 da. And, I'd be telling him, don't touch me, get away from me, and I'm like, okay. And so like hearing that, I think helped my husband. Cause again, we're newlyweds. So if I'm saying like, it wasn't about vaginal dryness for me, it just was, I did not have a desire at all. Like, I'm hot, don't touch me, just leave me alone, like stand over there. Even to the point, like I would have our air all the way down, the fan going, and I'm still sweating, like drenched sweat. And for him, it was like, okay, we now take turns with him sleeping in the master bedroom because I gotta have the air where I need the air so I can sleep. For him, it's like, okay, I got to put on a hoodie and some socks and some sweatpants just to come into the bedroom because it's too cold in here. I can't sleep in here. And I'm like, look, I need that from you because I don't know what's happening. I don't know what's going on, but I'm going to need you to go into one of them other bedrooms over there because I need to be in this ice box right now. That understanding and having that community of people, I think, helped him navigate with me through this.
So I was going to say, did he understand that it wasn't like you rejecting him, but that you were like having some issue that your body was
he
going through the
understood
same?
because like he would touch me and go, you about to have a hot flash, aren't you? And then all of a sudden, here's the sweat. Like he could feel it happening. So he knew I wasn't making it up. He knew it was kind of like, I don't know if y'all saw the lady that was at the football game and she's sitting out there eating. And then all of a sudden her head just starts smoking because she's having a hot flash. That's literally what it would feel like for me. I'm like, oh, I can relate. That's how I feel like I'm, my grandkids was like, G-Ma, are you okay? Like, what is going on right now?
Wow.
It was years ago. The comedian Sinbad was talking about his wife going through menopause. And he said, you have to just kind of understand and be ready. And he made the joke that on the side of the bed, he had a parka. He would put his winter coat on because she would be cold or she would be hot. And then all of a sudden she's like throwing the covers off, talking about it's too hot in here. And then all of a sudden she's cold and he's on the side just taking the parka off and putting it back on and taking it off and putting it back on. But again, that's just something that, you understand. I woke up like Java. I got to change clothes because I'm soaked. My pillow is wet. My hair is wet. My clothes are wet. And now, you got to change and it's 2 a.m. and now I can't go back to sleep. and that becomes a problem. And just in relationships anyway, it just you just have to talk about it and have an understanding. And just it's just a part of life, but it's not a bad part of life. It's just life. Life be life. And that's what they tell me.
Yes. But then after menopause is not after it's done, after the symptoms are no longer present, you feel good. Right? Like you were saying.
I mean, like right now, like I said, I don't have the hot flashes that I was having. My body doesn't hurt like it was hurting, like my joints would just hurt. And I know, I've been diagnosed with osteoarthritis, like bone on bone in my knee, but it don't hurt like it was hurting prior to me doing the HRT. So right now, all I can say is, yep, thanks for the HRT. That's where I am right now with it, because I don't have the symptoms. The libido is back. Like all the things that I felt like I should have is back.
Mm. Hi, Nisha. So we're talking about menopause, and all the symptoms that comes along with it. So I'm getting ready to drop the link, Gwen, if you're still here, because you were my guest 2 weekends or 2 weeks in a row. But if anyone is interested in joining us on the panel to talk about their experience with menopause, you're more than welcome. Get ready to drop the link. Gwen, I invite you up as well. Okay, I'm getting ready to drop the link. Feel free to hit the link and come on up. Come up with us.
All right, I unfortunately have to go. I have to get these kids ready for bed.
All
Um,
right.
but it has been a pleasure being here with everyone, and thanks for inviting me, Wanda, and it was great seeing you as well.
Yeah, so thank you to Dr. Fowler, um, for joining in on this conversation. I definitely appreciate you.
Hmm. Yeah.
All right.
All
And
right.
then if you go to any, do you go to the football games?
Oh yeah. Oh yeah.
Oh yeah. So we want to go. Oh, my husband and I,
Uh-huh.
we want to go when you all play Michigan.
Ooh.
but
that's it.
we
That's
but
a
we're gonna
game.
go when do you okay, real quick, do you know if Michigan's going to Ohio this year?
No, we're going there this year.
Oh, okay. So we may still go to that, but we want to go when they go to the shoot.
Yeah. So that'll be next year.
Okay. Okay.
Yeah.
Yeah, because yeah, we'll have to
That's
talk because
that's a wild game.
Ohio is no joke. There's no joke. But okay, I know you gotta go.
All right. We'll
Thank you,
talk
thank
later.
you.
All right. See ya.
Bye bye. All right. So Gwen is joining us.
Hi. Hi, everyone. So good to see all of you. Sorry, I just got off of work.
Yes. So like I said, Gwen was on last week as well as the week before, telling us about her experiences.
Mhm.
And she when you can let them know how long you've been um, on hormone replacement therapy.
Yes, I have been on that for about a year now. And it actually really saved my life because I didn't know what I was going to do. But as I was on it, I also had to deal with switching brands and switching dosages to make sure that it was right for me. And I'm finally on one that is good. So it's like trial and error. But when I got through all of that, I feel amazing. Like I feel like whereas before I couldn't even get out the bed. Menopause hit me so hard. So I got myself back. I feel like
Mm. That's the same thing Java was saying,
yes,
right? You can
yeah.
start to feel like you again.
The mental thing, I don't think people understand how your mental wellness kind of goes away because it's one of the symptoms of menopause. And I experienced that symptom, and it was from not sleeping. Like Java had said earlier, the night sweats. If you don't get enough rest, you're not going to make it through life, right? That in the military, that's one of the tactics that they use to make people just stay awake, and I was only getting an hour of sleep. That's it. And I did that for 3 months. It was horrible. I was falling asleep behind the wheel. And thank God, like I said, once I started HRT, all that went away. I sleep really good now.
So Lala said there's hope.
There is hope.
And
There
I
is.
will be giving it a try soon. I have my appointment in a couple of weeks.
Yeah.
So stay tuned.
You just have to be patient. Some people are lucky and the dosage are right the first time. Now, I had a couple of experiences where I had switched pharmacies and I had to, they gave me another brand without, I didn't think nothing of it. But that brand I could not use. It gave me a really bad allergic reaction. So I had to stick with the brand that I started with. So you have to take all of that. It's a trial and error. But once you get to where you need to be, it is like freedom. So just be patient, when you start, and I do believe when you go see your family doctor or your OBGYN, like women that are a certain age, it should be a conversation, about hormone replacement therapy. I mean, you can choose to take it or you don't, but it still should be a conversation. And it was never, I was having menopause symptoms in my 40s. I didn't realize what it was, right? And all the doctors did, and I was going crazy, really. All they wanted to do was put me on Paxil.
Right.
When
So
really
yeah.
it was
So
my hormones.
I'll say that and I can't speak for every doctor.
Yeah.
When I was in training, it was we pushed like hormone replacement. If you walked in, that's
Mm.
what we did. But
Hmm.
then, because I did 3 years of my training, about 2 years after I got out, then the whole thing was, oh, we were wrong.
Right.
You can't just give everybody hormone replacements and everyone has to come off of hormone replacements. And the first thing I thought was, all those people that I saw, because I had a very large female practice when I was in Detroit.
Hmm.
And I was
Hmm.
like, all those women that I put on hormones, now you're telling me to take them off of it.
I
And
remember.
then I was moved to Kalamazoo, and when I saw some people, those are fighting words when you start telling people, I want to take
Right.
you off your hormones. And I'm like, ma'am, the studies show. So I think there's this disconnect, and unfortunately, um, and a lot of stuff that we are taught, depending on where you are, depending on your location, depending on
Mhm.
your patient population, you may not get as much as experience. And then a lot of times now everything is so specialized and everybody goes to everything because we don't have time or you don't want to get sued or whatever your reason. So everybody
Right.
goes to all the specialists, but everybody doesn't have availability to specialists.
Hmm.
So that is something where you do, like Gwen has been saying, and a lot of people, you have to do your own research.
Hmm.
You have to be your own advocate. But I do always tell my patients too that it is against the law, at least in the state of Michigan, to practice medicine without a license. So some stuff you need to let your
Yes.
provider take care of.
Yes. I
But
agree.
it's a hand in hand, and you shouldn't have to navigate alone. And
Hmm.
again, you always have the right to seek out someone else if you
Yes.
can't get what you need from that person.
And I love my OBGYN. He's a male, but when we first started this together, he made sure he ran the test. I came back a month later. You know what I mean? And when things didn't work out, he came to check me out. So you have to have a person like that because it is, um, you know, it's it's like you just got to guess what is right until you get there, right? That's what I'm trying to say. But he was he's amazing, and I'm surprised because he's a male. Usually it's hard with male doctors, but I'm so thankful that on the first try of seeing the OBGYN I'm seeing, because my family doctor now, she wouldn't do it. She was like, I don't believe in that. It causes cancer, it causes all these things. And even after I got on it, she was like, well, I still need to test you out. I said, I'm gonna tell you this. You touch my dosages because you have nothing to do with this right here. And I'm done. I'm not gonna come back. But she said, well, I just want to make sure, and I said, okay, and so all my tests came back. My blood pressure is good. That's what I think she was worried about. But I was like, she's young and I get it. But I hope she never experienced menopause symptoms, but when she does, she's gonna try to probably do some research. But yeah, so you have to find the right provider. I don't think you should get the stuff off the internet or any of that, because all of it is trial and error. So you have to have someone that's checking you out as you go through this process. I mean, you just have to, because it might work and it might not, but at least you have a provider that's helping you out, to get through to what's right for you.
So Jasmine said, that's interesting. I would have thought it would be a topic of conversation at the doctors as well once you get to a certain age.
So
So,
they didn't they didn't talk to me about it. Like I said, they put me on Paxil. They gave me the whole time was because my hormones was not regulated.
so like
So
I said, it's like an internal heat, like a fever.
It's not like a fever, but it's definitely something you just, it's like a radiating heat through your body. Like it's like radiating. And then the sweat, like you're just, yeah, yeah. It's not like a fever.
So
kind of
Lala
hard to
wants to know,
explain.
what is Paxil?
Yeah.
Paxil is an antidepressant,
Yeah. So
but I was going
used for
nuts.
mental health concerns. Yeah.
So they thought you were having depression and
Yes, yes. One of the signs of menopause is your mental health, right? Because you don't have enough hormones to regulate what's going on in your brain. So I'm gonna tell you, when I started HRT, I think we talked about this the last time we were on. I was able to go to a counselor now, to sit down, to get some things out. Whereas before, I did go to a counselor and I was like, this is not working. It's because, I I think my mind just wasn't comprehending what was going on. So, regulating my hormones has really been a blessing for me. Like, now I can see things clearly. Now I know how to set boundaries. Now when I go to counseling now, I can understand, you know what I mean? Whereas before, it was just all gibberish. Like, this ain't helping me.
she said the Lala said the more information. Yeah, and that's one of the reasons, Lala, that I wanted to have this conversation.
Mhm.
And again, that we've talked about this over several weeks is because one, I'm of that age, right? Um, and all women will go through this at some point,
Mhm.
right? And we don't hear, or I didn't hear enough about it, or I didn't pay enough attention, right?
Right.
Because I wasn't at that age. So I'm hoping this information is um, I hope we're giving information that you can use. I hope you heed the information, right? And do your own research, talk to your own physician. Um, but through this conversation, at least you have a general knowledge of what to ask your doctor. At least you have a general knowledge if you're having any of the symptoms. Oh, maybe, right? This is a sign of menopause,
Mhm.
that I'm going through. So, Lisa said it's like an inflammation.
What is like an inflammation? The hot flash? Is that what she's talking about?
Lisa, if you could put it in the chat to let us know what exactly is like an inflammation. What are you asking? Oh, wait. She said, for me, it's more upper. So it may, So she said for her it's more upper body, arms, neck, and head.
Hmm. Like a
So
frozen shoulder.
so is
Uh,
it? Are you talking about like joints aching?
Oh, she said, yes, the hot flashes. Baby, let me
oh.
tell you something. I was sweating behind my knees. Okay. Like, them hot flashes was coming, radiating all over my body. And when I got to the back of my knees, I'm like, why is the back of my knees even sweating?
Wow, that's like saying sweat was dripping from my hair, from
It
the ends
really,
of my
like,
hair.
it was. It would drip through my hair, and like I had to carry a towel. I was the Abbott fan carrier. I would have my fan so it blow right on me. I had the fan that went around the neck and had the thing shooting up like this. Like I had to carry my towel, my fan everywhere we went, because there's no way I could go out and not have those things, because any little thing, if I laugh too hard, now all of a sudden I'm just profusely sweating. Like, it would just come out of nowhere. All of a sudden I could just be sitting there, and all of a sudden I'd be like, oh Lord, here come a hot flash.
Mm, mm. So wow. So Lisa, um, you get the conversation, right? Because it sounds like you're right there. So let me say this, Nisha, before I read your question. My prayers for you and your family. Um, I'm serious when I say you have. I'm praying for real. I'm praying for real. Okay, so Nisha said women still afraid to talk about it because some women just don't know. Her cousin turned 50 and couldn't understand why she's losing it and asking, cuz you might be in menopause. You might be menopausing. Yeah, so Nisha, we were saying that some women don't know, right?
Mhm.
And then if they have a significant other, you know, it impacts the relationship. And
So look,
women,
somebody's asking about like how long this lasts until you die, like
Right.
until you
Forever.
get your symptoms under control. Like once it starts, it
It's
starts.
forever. Even if
It's
you get your
forever.
symptoms, it's still there. It's forever, ever.
Yes.
so Lala, this is what you're in for. It
Yes,
lasts
ma'am.
forever.
Yes, ma'am. And like I said, my girlfriend who's been doing the HRT for over 10 years, she says she's gotten to the place where she definitely can tell when her pellets have worn off and it's time to go get new pellets put in, because she says her mood and emotions change, her libido level changes, her desire to do things, like she doesn't have the energy. It's just kind of like blah. But when she goes to get her pellets, then it's like the cloud has moved and the sun is shining again.
So
Because
so with the pellets,
yes,
is it every woman is inserted in a slit in their butt?
well, because she works out a lot, she says she has almost rejected pellets, so she gets them in, a fatty part on her hip, um, her side pouches, instead of getting it in her butt, because when she works out, they try to come out. And she said that's very painful for her.
Oh,
I felt it initially when I first got it. Like I could feel the little, because it's just, I wish I would have been thinking. I could have sent you the video to show how the pellets are inserted. Because I was like, yeah, I'm gonna need to see it from beginning to end. I want to know what y'all back there doing. Um, and our doctor, she's very informative. Like I text her at 10 o'clock when I got my second test results and was like, okay, well, why did this go down? And how come that went up? And then my estrogen only went up 2 points. And, so she called me and we walked through it and talked through it. And she was just like, we're going to test you again in another 6 weeks. I want you to increase your DIMS And she encouraged me. She's like, I'm gonna need you to have some more sex. Like, I want you to have some more sex. Because at first, like, it felt like, honestly, like my vagina was gonna fall out. But she said that is the blood rushing back to the organs to do what it needed to do. And she was right. After I had sex, the pressure went away. And I was like, oh, okay, all right, I guess that do work. Just, but again, I was experiencing all the stuff for a year and a half, not knowing what was going on, really. I knew I was perimenopausal, but was like, okay, I ain't getting a period, but once every 6 months. Okay, cool. But all the other symptoms that was coming along with it, I didn't like.
So then, by you saying, like, for a year, like, you didn't really know what was going on, really speaks to Nisha's statement when she said, we're afraid to talk about it.
Well, I knew that it was menopause, but again, like, how do I, and I asked multiple times, where do I get some relief? Where do I get some relief? Where do I get some relief? And I was given this long list. Oh, you got to take some black casserole, some primrose, some something. It was like 15 different, yeah. I even asked Dr. Selena when she came here, like, okay, what can I take? Because, baby, I'm sweating behind my knees. And, she gave me a couple of things to try. And I was like, I am not about to sit up here and take 15 pills every day. That's not going to work for me.
Take off 15, but I was still working through it myself, and it ain't working.
So,
my appointment is on the 8th of August.
Yes.
Okay, so Selena, are your appointment for HRT?
I am going to discuss it. Yes.
Oh, okay.
Yeah.
So you heard it from the doctor that she herself is going to, she's considering HRT.
Yeah. I've tried the other things, and it's not
too.
really working.
I tried everything.
And I try things. I try to do stuff that I tell my patients to try before I just, if I'm going through it, I want to see. So that was my experiment. I have experimented enough. I have enough information. So
Lala said she's gonna start giving her mom more air hugs. She said because her mom always sweating.
But we also don't talk about the sweating, your cardiovascular health too as well. I look at the women, all my mom and my aunts, they all are dead, right? And I feel like I think they didn't know about menopause because no one ever talked about it. I didn't know anything about it. I had to find out on YouTube about menopause because I didn't know. There was no one talking about it in my family. No one was talking about it. But I think half the problems that they were having was because of the lack of estrogen and progesterone and testosterone in their life. And I think because estrogen heals a lot of things. It heals. If you don't have enough, it's hard to heal, like wounds and stuff like that. It's so hard. So I think, you know, because of the lack of information, a lot of times we don't know. And then, especially I think in the African American community, is that, if we are not together getting this information, we're not going to get this information, right? So you don't even know. I didn't even know what was going on with my body. I just didn't even know. I just didn't know. And this is why I'm so passionate about talking about it, because you don't have to suffer. You do not have to suffer. And, like I said, just do your research out there and take these tools. It's just a tool to get you where you need to go. You know what I mean? You still have to exercise, you have to have nutrition, all those things. This is just a vehicle, just a tool in your toolbox so that you can make it through the rest of your life. But I'm so glad we have shows like this because no, and asking questions, no question is a stupid question because you just don't know, right?
Yeah, because I sure didn't know. Like,
Mm-hmm.
I learned with the hormone replacement therapy that they put stuff in your booty.
I've heard that before. I didn't know if that was true or not, but I've heard that. It's funny. You should say that.
Wanda, don't say it like that because that make it seem like, they went through the anus and then put it in the hole. That's
Yeah.
not what they did. It's just a little tiny slit right where your back and the curve of your butt come together. It's a little slit, and then
Mhm.
they insert the pellet of hormone in there.
Right. So they just put a hole in your butt and put the hormone
It didn't even
replacement
need
in there.
stitches, Wanda. It didn't need stitches. Just a piece of tape, okay? Just a piece of
Yeah,
tape, and
I'm
it was.
joking. I'm joking. So, like I said, that's horrid,
Mhm.
and there has to be natural remedies or lifestyle changes.
And
Well,
again, when you try all of that and that doesn't work for you,
right,
and you're
right.
suffering, it is a suffering. When
Yes.
I'm waking up, I can't sleep. I can't even get through a meal without profusely sweating, without like feeling like I need to go home, take a shower, change my clothes, and all
Mhm.
just always icky. And then, you move because you can't sleep. You it just, I just wasn't willing to suffer. I'm just
Me
not.
neither.
So a lot of times when we talk about what's tolerable, that's when it's not tolerable. That's when it's a disease. It's dis-ease. You're no
Right.
longer at ease. And so if your hot flashes aren't that bad, because I had a woman tell me she never had a hot flash. She just woke up one day, didn't have a period, and life was good.
Mm.
So it's not that it can't happen,
Mhm.
and what we don't know. So everybody has to figure out their own path.
Right. Right.
It is important to take care of yourself beforehand, because I do
Mhm.
feel like if you had, poor habits and other problems beforehand,
Mhm.
throwing
Mhm.
on some loss of estrogen is not making things any better. And a lot of times what will happen is because you have symptoms that can be overlapping with other medical problems,
Right.
and then um, you have symptoms that can be also associated with depression. It's very quick and easy to say,
Mhm.
"Oh, it's depression." Um, I'm guilty of myself, because I thought, okay, I'm just depressed, and
Mhm.
I need. And then I was like, okay, I'm gonna fix it. I want the antidepressant that's supposed to
Mhm.
help with hot flashes, so that and then my mood will feel better, and
Mhm.
and for me, it's not working. And
Right.
you don't have to get an injection in your behind.
You
They
don't.
got pills, they have patches, they have creams. Um, so yeah, I don't know. We'll see, but I may be flying down to Dominican.
See, I
Now
take
that
the
I know where
patch
to go,
I
but
and
think something else, to talk about, and I don't know how insurance works because I
right.
pay out of
yeah,
pocket cash for my treatment.
yeah.
Here, I live in the Dominican Republic here, but it's also a U.S. regulated protocol that I'm using called
Mhm.
BioT. I just happened to get it during a special. It was Mother's Day here on the island. So the
Mhm.
doctor was running a special for us to get it done, and it was $400. And I'm like, okay, $400 every 6 months, I can handle that.
Mhm.
I'll make that happen.
I
Um,
don't think here insurance cover that at all. The pellets, they don't cover that. Um, but I'm on the patch progesterone and testosterone. They don't cover the testosterone either, but I pay for that because it works, But
So
I
you
think,
pay out of pocket too, Gwen?
huh?
You pay out of pocket too?
Just for the testosterone. My insurance cover my estrogen patches and progesterone.
Ah,
So, so the testosterone has to be made in a compound pharmacy as well. Now, this is what makes me mad. If I was a woman trying to be a man, I wouldn't have to go to a compound pharmacy, and my insurance would cover it. But I see this orthopedic doctor. She is went to the FDA to see if to open it up because women we need it. I didn't have when they did my test for testosterone, I didn't have none, and that helps your adrenal glands, help with energy, help with sexual libido. We need it, very
right.
little, but we need it. you know,
Yeah, I was telling them mine was like 0.62 or something like that when
I
I
had
started.
zero.
Wow.
So I have a couple of questions. So Lala said, so menopause is a disease.
Menopause is a part of life.
Right.
And it's a change that we have to go through. Just like when we were born, you're a little kid, and then all of a sudden you have a period. Then after that, now you're going to not have a period because now you are at the age where your body is not well equipped to be having a baby. Okay. And when I say that, I'm not just saying just physically, but yeah, I cannot see me. I love people's babies because I can give them right back. But to be running around with that kid, waking up all times a night, that's not gonna work for me. But I just look at it as it's a process that we go through. Your hair turns gray because we get older, and what happens is those chemicals change, and it has nothing to do with menopause. It just has to do with we're getting old, and that's gorgeous, by the way. I love it.
I know she looks amazing. I
Hey,
love it.
That's
baby,
not
all
that's
this
it. I
gray.
love
I'm
it.
like,
I love it.
Lord.
It's
It's amazing.
so, and it's just things that we go through as people who happen to be women,
Hmm.
because men go through things too.
And they
Your eyesight changes, your
Less
metabolism
testosterone.
changes.
Hmm.
Um, I can't do cartwheels anymore, but I don't need to. Um, but it's just a part of life. It's not a
Yeah.
disease, but it does have symptoms that can affect and cause you to be diseased.
Hmm.
Make sense?
Yeah.
Yes. Yeah.
Selena,
Wait,
did
wait,
you?
when
Okay.
before you, I just want to get through
Okay.
these questions before it's over.
Okay.
So don't forget, Java is cheaper. She said it's cheaper in the Dominican Republic. So that's
Baby, everything is cheaper in the Dominican Republic. Healthcare is cheaper
Hmm.
here in the Dominican Republic. I got full coverage insurance for me and my husband. 100% coverage is $2,000 a year. When I go get X-rays, it's like $4.
Mm.
To see a doctor, to see a specialist is like $28.
Mm.
So yeah, baby, everything is cheaper. Oh, Ozempic, I think there costs anywhere from $600 to $1,600 a month. Here, you could get it for like $300 to $400 a month
Mm.
wow, wow, wow.
without a
Um,
prescription.
so hi, Melinda. I didn't speak to you. For anybody who just came in, we're not going to be on here much longer. Um, but hello, hello, hello. Make sure you hit the thumbs up button. Make sure if you haven't subscribed already
Mhm.
that you subscribe to the channel. And if you are so led, please share this out so other women and men can have this information. So Melinda said, doctors visit for cripple. Y'all can read it because I can't read. Anxiety and depression for meds, which led to a referral to a
Mhm.
dietitian.
Exactly happened to
Exercise
me.
spouse still had depression and
Mhm.
anxiety, and
Yeah.
then, honey, those hot flashes started.
Mhm. That's exactly what happened to me.
Yes, yes, yes. So, so Lala was responding to Lisa. I'm not quite sure what Lisa's comment was. I'm sorry. So compound pharmacy is very expensive. It sounds like.
Well, I pay for my testosterone cream. I pay $150 for a 90-day supply. So I guess it just depends on which compounding pharmacy, and that could be very tricky too, because you got to make sure they know what they're doing with that. So because it's not FDA approved, for us. But I heard some women, and which I was going to talk to my OBG in my doctor about, is the astrogel. Somehow they can get that covered, but I'm not quite sure how they're doing that. And it's packets of gel. And so with a man, they use the little packets. They use the whole thing. For a woman, you only use like a dab, and that packet probably is going to last you 3 or 4 months. A little packet.
Mm,
So I got to figure out. I was doing some research. I got to do more. That's what some of the ladies are doing is the andro gel, but you can get that could be prescribed.
All right. So Melinda says she's working with her doctor on finding the right dosage.
Yes, it's a trial and error.
Yes, yes.
It's
And
a trial.
then Lisa said before bed she takes apple cider vinegar shot. It's not the best, however, she's able to sleep more at
Mm.
night.
Yeah, I used to do that, mix it with some cranberry juice to make it tolerable. It didn't help with my hot flashes at all.
Everybody is different. So if it works for
Yeah,
you, and sometimes it works
that's
for a little
kudos.
while and then it does not work. Because I did
Mhm.
have some things that, oh, this is working. Then, about 3 months later, it's not working. And you're starting to spend a whole lot of money on stuff
And
that's not
stuff.
working,
Yeah.
and just go to what you need. But
Right.
with that, I don't have a little one, but I still have somebody in my house.
Right. You're not an empty nester yet.
Y'all kids are grown. So I still got to get that last one together because he has to volunteer and everything tomorrow. But
Okay.
it was really pleasurable. I learned a lot from you all as well. And
Yes, thank you.
the story will continue. I think it's
Yes.
August 8th, somewhere around there.
Yes, and look,
All right.
we'll have to have Dr. Johnson back on to tell, so she can tell us about her experience with going
Yes.
to a doctor and
Yeah.
speaking about,
Yeah,
should
it's a different thing because I'm trying not to tell them what to do because I'm trying to be the patient, and
right,
you have to be able to release and be the patient, but you also have to be an advocate. So,
right.
Yes, you do.
right.
You
Well,
got
you
that
ladies
right.
have a wonderful evening.
Thank you,
Yes.
thank you. We're getting ready to get off here in just a few seconds, but thank you.
Okay.
Thank
Bye.
you.
Good seeing you.
Good night. All right. Melinda's just saying, and we've been saying that pretty much all night. Like, you deserve, like, as a woman, right? You deserve to feel your best,
Hmm.
right? To go to the doctor, to advocate for yourself.
Hmm.
So, Nietzsche says she needs to fly to the Dominican quickly.
Yep, you sure should. Come on, girl.
Um, she said that the apple cider vinegar, I'm thinking she's talking about, helps for the inflammation for her.
Yeah. But I was explaining earlier, like I would have hip pains, and I've been diagnosed with
Hmm.
osteoarthritis, and my ankle would hurt. But since I've been on the HRT, my hips don't hurt anymore. Like I can easily walk up and down stairs, and
Hmm.
it's I can tell the difference in the way that my body feels and have reacted to it.
I was catching a cramp in my leg.
Mm.
Mm, mm, mm.
Is that menopause?
Yeah,
It could
that's
possibly be.
menopause too, girl.
Dude,
Um,
that's it.
so real quick before we transition out, I want to play a little game. Rapid fire questions.
Oh Lord. Okay.
Yes. So I don't have that many.
Mhm.
I don't have that many. And if you're in the chat, you can put your answers in the chat. All right, here we go. No, let me ask these questions. Hold on. Oh, let me ask these questions. So, real quick, hormones, friend or foe?
Friend.
Yes.
Friend. Okay. What's in your menopausal survival kit? Ooh, about to catch another cramp.
Well, my survival kit is now changing because I don't have the hot flashes like I did before. Because before, that fan and that towel was a must.
Okay.
Um,
When?
I'm the same way. I don't. It's been changed. Before I had to. I don't know what I needed. I was just so out of it. But now that I'm on HRT, my life is so much better, so
Probably
much
just my
calmer.
water bottle. Maybe my water
Yeah.
bottle is in my kit for real.
Okay. What is one thing you wish your partner, your significant other, understood?
That it definitely me not wanting to engage in sex had nothing to do with him. It was just my libido, like Gwen said, no testosterone. So I had no desire at all. Like I could care
Mhm.
less about it. And yeah,
Mhm.
so now, like I said, we get to be newlyweds.
Gwen, did you want to answer
Well,
that?
yes, I think I wish that people really understood that menopause is a thing, right? A lot of men don't understand that that's a thing. Just having a good understanding that this is real life, baby.
Hmm.
Um, and I'll end on this. What is one piece of advice um, you would give to the to to people watching?
Don't be afraid to have the conversation.
All right, don't be
Yeah.
afraid. And I think Nisha said it. Yes, um, that women are afraid to have the conversation. So her advice: don't be afraid. We need to talk about it. When
Do your research. I came with a full-fledged notebook when I went to go see my doctor. Do your research. Have your questions ready and be very serious because sometimes they try to rush you off. So do your research before you go to your doctor.
Because a lot of doctors are still with the old research of the
Right.
HRT and don't believe that, like, oh, it'll cause you cancer, da, 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 da. But there's been new research and new studies because the first one that they did was
Women Initiative. That's what it was
correct.
called.
Yes.
Hmm.
So, be willing to have that dialogue. And if you were an old school provider, find another provider, get
Hmm.
more opinions, educate yourself about what
Hmm.
you need for you because you
Right.
don't have to suffer.
Right. And that Women Initiative, those women were already unhealthy. And then the age demographic, it was like 60. They didn't use the right things, the right tools to do that
Correct.
study. So that's
Correct.
why that study failed.
okay. All right. So we still have questions. Um,
Hmm.
when they say inflammation, when they when you say inflammation, are you referring to or joint pain?
I was having inflammation, joint pain. Like my
Okay.
hips was hurting, my ankles were hurting, my knees were hurting. It was hard to walk up. I didn't want to walk up and down stairs. But now, like, I don't feel that inflammation and I don't have that irritation anymore. And walking up and down stairs don't bother me. Look, I even caught myself jogging a little bit. Like, oh, girl, you better be still.
So Lala said this information was great.
Great.
She says she's scared it right now, but thank you.
Don't be scared.
Don't be
Don't be
scared.
scared, girl. Don't be scared.
Don't be,
You're not
Um,
yeah,
alone.
you're not.
What
You're
Michael
not
Jackson
alone.
said, you are not alone.
And,
but
it's a shame that
Jasmine,
I was going to say it's a shame that African American women start a little earlier than our Caucasian counterpart. So it's scary because we don't have the information. That's once again, I love shows like this so that you can push the narrative.
yeah, and that's one reason why I wanted to do this is to share
Yeah.
information. So Jasmine said, "Thank you for sharing. Very informative." Nisha said, "Thank you, ladies, for sharing. Great information for sure." Lala said her mom had fiber.
Fibroid
That's a
myalgia.
yeah. That's a
Thank you.
sign of menopause.
Okay.
Hmm.
Um, Nisha said again, thank you so much. I will share with her 50-year-old cousin. Yeah, so thank you. I think that was the last comment. So make sure you hit share or make sure you share the live so other people can have this information. Make sure you hit the like button, and then make sure you join us here every, what's today, Monday? Oh no, this is our last Monday. No, next Monday. Yeah, join us next Monday because I actually have someone. I think he's had, and I don't want to misspeak, so I'm going to say he had at least 2 heart attacks, and he's had his second open heart surgery.
Mm.
So he'll be here next Monday to talk about that. So make sure you join us back here next Monday. But before then, join us here Wednesday, the day after tomorrow, because we're going to talk with a couple who they work out together. They do life together, they work out together, they live together. Yeah, so join us Wednesday.
Mhm.
All right. Have a good night. Have a good night. Thank you so much, Java. Gwen, thank you for hitting that link and being with me for 3 weeks.
I'm so excited.
Yes. And I
I
pray,
love it.
yes. I pray that you all have a wonderful night. I pray that something wonderful happens to you and for you.
Amen.
Amen.
All right.
Amen.
Thank you. God bless. Good night.
Good night.
Good night.
I forgot to hit in the live stream. Good night, everybody.